Moti Bai lives in a hut under guava trees in a field in North India. She sits here most of the day. This is also where she sleeps, cooks and eats. This modest hut is essentially a thriftily constructed tarpaulin tent, a bed fashioned from an old hose. It is Moti Bai's shelter from the rains of the monsoon season and the beating sun of the summer. Everything she owns is in this hut, even what might be the most important thing she has, a pain relief medication. Moti Bai has stage 2 cervical cancer. In 2013, she and her family traveled to a nearby town hospital where they paid for a biopsy and surgery to have her uterus removed. Only after surgery were they told that she would also need chemotherapy and radiotherapy. However, by this stage, the family could not afford any further treatment, and so they returned home to carry on with work, just to have money to eat. The financial cost of the trip and the surgery was extremely high. As a result, they now have a large loan on a credit card of more than £1,500. This is a life-crippling debt for the whole family, for a treatment which has not cured her.
Most of the villagers, they are poor, and they depend on their daily earning as laborers. They don't have savings. They earn and they spend. So when they don't earn, and once they start spending on something like cancer treatment, they really become more poor. At times, the expenditure is so much that they have to sell their lands, they have to sell their houses, their cattle. They have to sell their source of income.
At this point, still suffering, Moti Bai met the EHA Palliative Care team based at the local Christian hospital. The journey to the hospital involves a grueling 2-kilometer walk to the main road and then a bus ride into town. The whole trip is agony for her. The journeys have a wider cost, similar to going away for surgery. Time spent traveling to hospital means time not spent working and earning. Since the surgery, Moti Bai has good days and bad days. In the past months, the bad days have been increasing. Less energy, more pain, less mobility, more hospital visits. Because of these signs and the facts of unfinished treatment, the staff think it is likely that the cancer has now spread to her bones. 200 miles away, Ram Swaroop lives in a basic house in a rundown village. In 2013, he developed a small cyst on his mouth. After suffering through futile treatment from a village doctor, a makeshift dentist, and a local faith healer, he eventually met with the EHA hospital in the local town. Here he was diagnosed with mouth cancer. He refused referral to a cancer hospital as he could not afford either the travel or whatever the treatment they might recommend. It is now too late. His mouth cancer will kill him. He is receiving basic palliative care to manage his pain and wound. Ram lives with his son, daughter-in-law and grandchildren. But he is a lonely man, deserted years ago by his wife and often left isolated outside by his family. He managed to continue his work until recently, until the pain was too much and his health too poor. Now that Ram can no longer head to the fields to find daily work, he stays at his home. His son goes looking for daily labor to support them with one meal a day. A few years ago, Moti Bai and her husband farmed their own plot of land. But like many families in these parts already in moderate poverty, one bad weather season or turn of events can knock people's financial state and set them on a downward course towards total poverty. For many people, falling ill can be the blow that knocks a poor family off balance for a generation or more. So now they live on the Pradhan's land, splitting the earnings from the produce 50-50 with him. These tomatoes, for example, might now make them 10 pence per kilo. This cannot come close to paying off the debts.
In Indian culture, is the 3 tiers, from village level, block level and the district level. So these 3, there is Pradhan, there is block officer, there is district collector and the members. So village people can't go directly district. They have to go to Pradhan.
It is through the Pradhan, the official of the village level, that they can get hold of the below poverty line identity card. and so have access to government rations amongst other benefits. Ram Swaroop is not so lucky. Although the family cannot afford more than one modest meal a day, Ram Swaroop does not have a below poverty line identity card. Instead, this BPL card will be held by one of the village head's wealthy friends or whoever could afford to pay the necessary bribe for it. And so this man and his family are not officially registered as poor, nor can they receive benefits.
We could close our eyes and say, no, we're here just for the health. But the fact is, there are so many social determinants of health. And if we can identify them and start to work with them, on an average, our patient's health and his state of illness would be better. So even looking at Ram Swaroop, it's not just about his health, but if we could address his economic aspect, that would be more holistic.
If Moti Bai had been discovered sooner, the palliative care team could have guided her and her family through the choices they were forced to make. They may not have started treatment, which they could not afford to finish. They may not have missed out on the government funding for treatment they were entitled to. They may have been able to budget for all the miscellaneous costs that inevitably crept up. Now the palliative care team travel out to visit Moti Bai in order to save her having to make her own way to the hospital. This reduces the cost of traveling to the hospital and the cost of a day away from work. Although simple, this dramatically helps their overall economic situation. The team can also arrange and bring the government rations, guide her in nutrition, and counsel the family about access to necessary government benefits. Last week, Ram Swaroop was admitted to hospital with fever caused by a maggot infestation in his wound. The team can become involved in training these families to consistently care for the patient, cleaning the wounds, maintaining and monitoring their overall health, administering the correct medication, so that these costly hospital admissions are avoided. The Enhanced Palliative Care Program aims to manage these wider aspects of a patient's and each member of the family's life in relation to the consequences of an illness. Going further than providing physical care and pain relief, the team works hard to make sure the illness does not push these vulnerable lives deeper and deeper into poverty.
Can tell you.